Hi, I'm Dr. Shubhra Goyal. I'm an eye and face plastic surgeon. Welcome to Manghat. Let's talk about dark circles today. Dark circles are one of the most common issues which people experience. Almost 20% of the world population has it. A lot of people present to us, so I call it as like the gold mine of my practice. Typically, when a client or a patient walks into my clinic, they come with complaints of looking tired, looking sad, and people calling them that they haven't slept for days together, and they say, I have dark circles. My conversation typically starts saying that, do you even know what dark circles are all about? So let's not concentrate too much on the terminology which explains what is dark circles or so-called the dark circles, but let's try to understand what dark circles are all about. So when I start the consultation with the patient, I typically ask them about their lifestyle, which includes what they eat, what they drink, what is their life all about, what are they going through, what is their professional life, commitments, and so on and so forth, rather than focusing on the disease or the ailment or the condition which they present to. Because I believe all the diseases or all the problems on the face, typically on the face or around the eyes, are also the manifestation of what's happening in our body. So let's look at dark circle in particular. Typically, patient would say they would relate it to either the change of glasses, not sleeping well, I'm very stressed out, or I have cried enough and that's why I have dark circles. Well, these reasons are probably some of the reasons which cause dark circles or enhance dark circles, but why do they actually happen? Now, there are two reasons for that. Number one, how you treat your body. Are you eating well? Are you drinking enough? Are your hormones in place? Are your blood parameters in place? It has been proven that low oxygen supply, which happens because of low hemoglobin or low ferritin, also enhances dark circles. Deficiency of vitamin B12 also enhances dark circles. If you're not having enough water, what happens is the blood vessels, which are very tiny blood vessels under the lower eyelid skin, and the lower eyelid skin is the most thinnest skin in the body. So thinnest skin in the body would show through, and the color of these blood vessels actually shine through like a ground glass appearance and gives you an appearance or a feel of dark circles. Now, in addition, there are other medical reasons where, there are aging changes around the eyes, the skin changes, there is a lack of collagen, the bone parameters changes, and so on and so forth. Let's not go too much into detail of it. So if you look at this condition in particular, it is a combination of the changes of how much water you drink, what kind of food you eat, do you have any deficiencies, which manifest as pigmentation around the eyes. Now let's differentiate it from the pigmentation which is present since birth, which is a different medical condition altogether. So when we look at dark circles, we look at it in a very holistic way. We tell our clients, you need to first focus on how you are thinking, what you're doing with your life. Because if you are stressed out, there is an oxidative damage happening. There are a lot of free radicals being produced, and all this leads to water retention, change in the way the exchange of electrolytes happen across the blood vessels, and that will be one of the reasons why you experience that. So the client has to be taken on a roller coaster ride which they don't agree to believe or to follow, and they actually sometimes become unhappy and say, doc, we came for a solution and you're giving us some other, gyan or that, or a lesson on that. But it is very, very important that before you jump into any modern science treatments, please look into how you are thinking, what you are saying to yourself, how you're treating your body. Are your thoughts good enough? Are you being very negative? Are you being into the mode of resentments? And I always refer to a book by Louis Hay, Heal Your Body, Heal Your Life. And there is a big chart in that which says each and every disease in our body or a manifestation is a manifestation of how we think. So dark circles are also based on, if I'm not wrong, about internalizing your thoughts or being very stressed out. So don't be, meditate, treat your body with love, eat, drink, and sleep very happily with a lot of content. In addition, the specialists like us are always there to help you with modern treatments like, injectables or cosmeceuticals and so on and so forth, maybe surgical treatment. So they are just an additive factor to what you are already doing to your body. So dark circles is a complex situation, is a complex condition which does not have just one treatment. It has to be a tailor-made treatment given to an individual based on their presentation. And one more thing which I want to share here is that, a lot of these advertisements on the media or on so-called the Google doctor tell you that if you apply this cream, it will vanish, or if you do this will happen. But a lot of them are not correct. So be ready for the realistic expectations and outcomes. Dark circles can never be 100% corrected. Yes, they can be lessened, they can be reduced, they can be made less obvious with the combination of your internal and external transformation journey, which I always call as a journey, because nothing happens overnight. So even if you're taking a modern treatment, you need to be committed to it. Even if you are trying to change your life in terms of how you think, eat and drink, it takes time. It's a journey. So stick on to it and move on with these changes. And last but not the least, I always show my pre and post, because there was a time when I had big fat raccoon eyes with dark circles, and if I can manage it based on how I have transformed my life in terms of being disciplined, taking care of all the XYZ parameters in terms of the internal health, and of course using some of the products, why can't you do it? Let's be in this journey together and take it as a holistic approach to dark circles. Dark circle is one of the commonest conditions, yet the most complex one. So while dealing with it, we need to have a tailor-made approach and treat it both internally and externally. So if you relate and if it answers your questions about dark circles, please like, share and subscribe our channel Manghat.